You're tuned in to the Zelos Podcast, the show that's all about the pros behind the pros. I'm your host, Rocky Snyder. This week, Stacey Hardin is with me. She is the medical and performance director for the brand new National Women's Soccer League, Bay FC. That's right, the Bay Area has their own women's soccer team, and it's going to be fantastic. She is going from Minnesota, where she helped that expansion team, to women's soccer and do the same thing for the Central Coast. Now, before we get underway, if you're looking for continuing education, you can go to my website. There is online courses and there's a calendar of events coming up. But, this week we actually will be in Providence, Rhode Island at the 3-day functional summit for Perform Better. I've got a couple of things I'll be presenting there and a lecture and hands-on. But if you can't make it, I know it's last minute, look for next month, the end of September. I've got a 1-day workshop also happening back in the Providence area. Actually, it's in West Warwick, Rhode Island at the Perform Better's Functional Training Institute. It's 1 day. If you're a physical therapist or athletic trainer, for that matter, strength coach, personal trainer, and you've got your clients, patients, or athletes that are bothered by chronic issues that keep coming up, you think you've got it dialed in, but then it goes away for a little bit and then comes back. Well, this is where we're going to try and hunt down the underlying root causes and get a better understanding of closed chain biomechanics and how we can tap into these joint coupling relationships to help enhance performance, but also to deal with chronic issues. Just go to performbetter.com, sign on up. There's still a little bit of room, and the early bird registration has been extended. So that's going to be September 27th in West Warwick, Rhode Island, recalibrating movement from the ground up. Now, I just finished my Master's of Science with Setanta College in Sports Injury and Return to Performance Management. You could go on that track too, but they've got it for performance coaching, sports psychology, and more. Just check out setantacollege.com, enter the code RS10, and it'll get you 10% off tuition, kind of like just saying, hey, Rocky sent me. Meanwhile, follow us on Instagram at Rocky_Snyder and click that damn subscribe button. I know you've been listening for a while now and you still haven't punched it. So do yourself a favor, tell 2 friends about the podcast and click that subscribe button. Enjoy the show. Stacey, I love the fact that you're right in my backyard, and I should actually have driven up to the Bay Area so we could have a face-to-face and record this in person, but maybe another time we'll do that. But first of all, thanks for coming on, Zelos.
Oh, no, likewise. I was thinking I should have gone down to the beach, down to Santa Cruz today. Been really excited to meet you. I've heard about your work for a number of years, so thank you for having me on.
Oh, it's truly my pleasure. So, how about this? Give me the lowdown. Like, we're both Quakes fans, first of all. You growing up in the Bay Area, starting out in maybe I would say the 90s. We're probably going to the same games. But from there, how did you land the gig at Bay FC and the circuitous route, I guess, through school and all that? Give us the lowdown.
Sure. So, like you said, born and raised Bay Area, grew up with earthquake season tickets. So that was kind of bred into my blood from a young age. Grew up playing soccer, got injured. Same story as a lot of people who go into this line of work. So figured out that the body probably wasn't going to make it in the professional world. So decided to turn to my mind. Went out to Boston. So did my doctorate in physical therapy there. Bachelor's in training at BU, Boston University, Boston
right
College.
On.
Yeah. So that was fantastic. A medical and sports just hub, everything you could ask for there. Just fantastic. And I know you talked about the Patriots and, being not a Revs fan.
No. They're good and all that, but my heart's with the Quakes. So did you hang out with Mike Boyle and at his facility there, or was he around at that time we were going to school?
Yeah, so they won the national championship in 2009. So I was actually their student athletic trainer.
Right on.
Yeah, so I had some pretty cool hockey experience. And, although soccer was born and bred into me, hockey's really cool. Like, I really like hockey.
Excellent.
It's, like all the really cool free flowing parts of soccer and like that creativity piece with like a little bit more, action and just some of those other parts of sports that are exciting too. So hockey was great there. Obviously there's a lacrosse community, which is different. Lacrosse
Huge.
wasn't big out here at all. I
No.
had no lacrosse exposure growing up, and then I knew American football probably wasn't for me, and so BU didn't have that. So I was like, all right, I'm surrounded by all these incredible schools around here that do. But yeah, it was an incredible. I ended up being there 9 years, so I did all my schooling, and then stayed on as a staff member, part adjunct faculty, part working with the student athletes, and that was so cool. Like just a dream first job.
Right on. Okay. Bay Area, going to Boston and being there for those years. I recall there being some really nasty winters at that time. There was a few
Yeah.
years my family would, it was like there was a blizzard every other weekend through January and February. And one of those years, I can't remember which one it was, but how was that? Just out of curiosity, how was winter in New England for you?
Yeah, that's a great question. And I remember the 128-inch winter. I was I was I was supposed to be training for a marathon. And you notice I say supposed to be because the marathon never happened that year. Obviously, the Boston Marathon is huge. BU, their medical community, has a big presence there. It was something we did as a staff, big volunteer event. So I was finally excited to run it. And yeah, the indoor training with no ability to get outside are very limited. It didn't go well from a training perspective, but um, it definitely brought us together as a staff because we would have a lot of folks who were commuting in and they just couldn't get in. So we came together and said, like, I lived close to campus. I walked in and it was like, great, I'll cover this until they plow the roads because that's what we're doing. We're a team and that's how we're going to figure out how to make this work. So it was a really, really unique experience with all that snow.
Yeah, speaking of unique experiences, I remember walking across campus in Amherst and in the dead of winter, and it's cold when the moisture inside your nostrils freeze and you can actually hear the crystals breaking up when you wrinkle your nose. I don't know if you experienced that in Boston, but you eventually made your way to Minnesota FC and worked up there. And so you're a glutton is really what it comes to when it comes to winter, I imagine. You're like, "Oh, Boston, yeah, that's for amateurs. I want to go where I'm almost freezing to death. So take me to Minnesota."
Yeah, that was exactly my thought. Actually, the intent was to come back to sunny California. I made it about halfway there. So, ever since I was 12, I guess I told my parents, and I remember this vaguely, but I told them I wanted to work in Major League Soccer and I wanted to be the person on the field. And actually, one of my clinical instructors went to university with one of the athletic trainers who worked for the Revolution at the time.
Huh?
So I got it's such a small world. So I got looped in through him. He was going out to Minnesota to be part of their expansion. And he called me and said, hey, I know this is something you've wanted to do. Do you want to come to Minnesota? And I said, what? Where? I've never been there, huh? And
Oh, you betcha.
yeah,
Yeah.
and then I got on a plane and thought it would be maybe a year or two, just kind of go out, scratch that itch, and come back, and ended up being there for 7. So life happens.
7 years.
Yeah, life happens.
Crazy. So tell me your position when you entered into Minnesota FC and when you left.
Yeah, so I started as the assistant athletic trainer and physical therapist. In our expansion year, between our medical and performance side, we had 3 people. So we had a head of performance, we had a head athletic trainer, and we had myself as the assistant athletic trainer slash physical therapist. And that was it for the first year of a professional franchise.
I have a feeling there were a lot more slashes, slash physical therapist, slash this, slash that. I mean, only 3 people handling it all.
Yep.
Well, that's learning by the firing squad, I guess.
Yeah. I mean, and we learned so much and we did so much. And looking back on that, and especially as I've like built out staffs over the year, it's like, well, numbers are one thing. And certainly 3 was not the magic number. But, just really being able to prioritize, being able to communicate effectively, being able to kind of communicate expectations to different stakeholder groups and say, this is really what we're going to be able to do with what we have. What are the priorities? How can we execute those? So it was a huge, really fun opportunity to grow that organization. I ended as the senior director of player health and performance, so overseeing all of the player health and performance from our first team down to our academy system that had
Oh, wow.
130 players in it. So the club blew up, the structure blew up, the infrastructure, the people. It was really cool.
Wow. Okay. So you must have acquired some really cool tools to help you manage all of that. Like, what were the essential ingredients that you needed to, as the director of player health and performance, like, what was it that you had to have in your back pocket to make this work?
That's a great question. I think first, and people ask a lot about expansion because I've done it a couple of times now. Um, you have to work hard, and I know that sounds silly, but sometimes people say, "Yeah, I really struggle with work-life balance, and getting up early and staying around late, and I want to have a better balance for myself or my family." Like expansion's just not that. So having a realistic idea of what it is, being able to work really, really hard, and then being able to understand what the priorities are from your key stakeholders. And so I always say, like, okay, give me what the priorities are. We'll figure out the actions that go with them. You get the words and the actions to match, you're in a good spot. And I think sometimes in expansion, the words and actions don't match because there's just so much going on that things can get a little lost. So really simplifying it down to, hey, these are our priorities. This is what we want to be really good at. This is how we're going to execute it. Then you can always build on from there. Like, what are those foundations first? Always foundations, and then build on that solid foundation.
So, what were your core values? Because that's really what you're talking about, is like a business developing a mission statement and having a certain thing that they always come back to compare where their direction is going or what's coming in their way. So, what were some of the things that made up your team's values?
Yeah. So we wanted to be evidence driven, which I know is a buzzword, but it can be really challenging in pro sports sometimes, where you have access to a lot of different technologies, ideas, resources, but being able to have some level of objectivity included in the decision making. That was one. We wanted to be player first, so we wanted to really make sure we heard what the person in front of us was saying. That's another, I think, challenging part sometimes in pro sport, where life moves really fast, and everybody wants really quick decisions, and everyone wants to move and go. Having those conversations and really hearing the person in front of you, and then being able to synthesize that into a very clear plan that all stakeholders can understand. I think those three things together were what we always tried to point back to say, like, okay, is there a rationale behind this? Is there some sort of evidence or theoretical component to this? Is the person on board with this plan? And has this been communicated to everybody else? And I think if you get those three down, then you can move along. And then if you need to deviate from the plan, at least you're like, hey, here's the plan before, not this was the plan. Now we're deviating. Now we have this other, hiccup that we need to address.
You talked about stakeholders, and so putting the coaching, like the soccer coaches or football coaches, however you want to pronounce it, and the athletes and their families, putting them aside, the other stakeholders. I'm just wondering, you came in with two others, and then you gradually got up to the point where you're director of player health and performance. At that point, how many others were on the team? How did you expand, and what roles were delegated out to new titles or new people?
Yeah, we ended up with 18 full time when I left across the organization.
Whoa!
Yeah. And then we also have our adjunct community through our medical network. And I mean, they were an incredible partner. Um, but I think that's where we started to look at, like, what are the parallels across all the different pathways that we absolutely want to be there. So as somebody goes through the system, like, here's the standard of care for athletic training, here's what they have access to, here's the coverage model. So it doesn't differ so much team to team, which we see that a lot in organizations where the first team can be treated significantly different than
Yeah.
everybody else. And that was not a priority. That wasn't something that what we wanted to do. So really being able to treat that like consistent care and performance approach. And then once you do that, then you can put the people in there and say, great, like this person is really good at this, then they're going to go in this role.
Okay. For your role, are you DBT?
Yeah.
Okay, so you've got your doctor in physical therapy, and I'm imagining that you began at BU with athletic training. So do you have
Mhm.
your master's in athletic training as well, or your
No,
bachelor?
that was before the master's day. So it was
Okay.
a combined 6-year accelerated bachelor's athletic training, doctor of physical therapy.
Dang. Okay, great. So you've got those, and that was your core focus is to really work with athletes and like many many American corporate structures is you find somebody that's a brilliant tactician, brilliant technician, and they are doing such a great job that you feel like, oh, we want to replicate what they're doing. Can we duplicate this person? So they put them into a managerial role, which is probably one of the worst things on average you can typically do because you're pulling them out of the environment that they're thriving on rather than figuring out a way to bring somebody in that management position. So this was long-winded, I'm sorry, but I'm wondering, you went up the ranks and now at Minnesota FC, before we get to Bay FC, you're director of player health and performance, if I'm getting the title right. And so how much were you able to stay with the athletes with 18, like 17 other people? You increased 600%. I just can see that there's something that becomes almost within your grasp, but just outside of it, and that's being with the players. Like, what was that like as you progressed with your role?
Yeah, that's a great question. I think you hit the nail on the head. Like that is a huge, huge challenge because being a really good clinician or practitioner or coach or really that hands-on person, it's a very different skill set than being a leader. I mean, some of the best leaders that I've seen in sporting organizations have like very little clinical expertise or did it for a very short period of time and said, hey, this isn't for me, this isn't what I love, like I don't want to see another ankle sprain. So I think just acknowledging first, like those are two very different pathways, very different skill sets. And that challenge does exist in pro sports and in other, sporting models for the reason that you just outlined. So kudos to you. And if you can figure out how to fix that, I think you'll fix a lot of things for
What
sure.
was it like for you though? Like, were you longing to get back on the pitch, or did you somehow keep your hand in the mix and yet still focusing on developing this structure, this organization?
Yeah, so I was still involved in clinical care, so more in the long-term rehabs, would do some on-field coverage, some, return to play on the field. So really trying to look at the whole structure and all of the people that we have and saying like, hey, this person is a really good athletic trainer. They are great at emergency care, at acute response management, great. They are the person who is 100% of the time covering training, no problem. So figuring out within the system who you have who's really good at those separate areas, which allows you to free up a little bit more of your time. But speaking honestly, that's been one of my biggest personal struggles is saying like, do I really want to remove from what I love doing? And that ultimately is, when that player gets back on the field and they score that first goal or they make that first hard tackle and they come out after the game and run out and they're like, that was awesome, I feel so good, or that was awesome and I like feel okay, and that's okay too, things will keep getting better. Those are the whys. And so that has, for myself, and I know a number of my colleagues in similar positions, been something that you wrestle with is how can you still feel that and be part of that while also learning how to do a new job, learning a new set of skills. A lot of it, which is people facing, and so it requires a lot more time than just, hey, I'm going to sit here and make this program or rehab plan. It takes a lot more conversations and face to face interactions than maybe you've previously done.
Sure. Okay, we're going to move forward and take me to Bay FC. How did it come about that with this expansion team, brand new team, everyone's excited around here to have NWSL right here in the Bay Area? But how did it come about that you're there?
Yeah. No, so I mean, another, kind of similar story. I've had, colleagues through various, connection points in my career, and it was an expansion team, and it was where I wanted to be geographically. And somebody told me you're either crazy or you love expansion if you do it more than once, and so signed up to do it again. But I think what I explain to folks is you get this incredible opportunity to build something and to be involved with all these projects, whether it's building a stadium or a training facility, whether it's setting policy around roster construction. Like, there are things that you may not do in your entire career. If you work for established clubs, you may not do them for your entire career. If you're part of an expansion group, you're going to do a lot of things that you've never done before. So it's really being open to that idea of, hey, I'm going to try something. Again, we're going to go back to what are kind of our North Stars or our priorities, and how can we make sure those actions align with the words. And then you keep going. You keep going, and the puzzle pieces start coming together, and then you have a product on the field, and you keep tweaking it.
Okay, well, give me one example of one of those surprise things that you didn't know you were going to be doing when you got there. But hey, here we are. I guess I'm doing this.
Yeah, I think one of the differences was with Minnesota United. They were an existing club, and so they had some infrastructure, but they essentially got kind of promoted into MLS. There's an obviously promotion relegation here, but that's kind of the best analogy. So there was some infrastructure, there was some staff, there was some equipment, there were other sums. At this expansion, there wasn't. So this is a brand new team, brand new facility, brand new infrastructure. So even some of the things like, where are the balls, where's the order of clothes, do we have the cleats in yet, things that you maybe take for granted. Kind of peeling it back to its most basic of, can we actually like operationally run this thing, then you layer on all the other components to that.
Wow. Okay, and how about this? We call it the what the heck moment. It's just like it's something that happens when you're there. You're getting you're got your feet on the ground. You're doing this, and then what the heck? Like it just surprised me. Didn't see that one come or anything like that. In the role that you've taken, you can include it back to Minnesota or anything like the things that you don't get trained for, that you're not necessarily schooled on, and suddenly you find yourself thrust into this scenario or position. Anything like that come to mind?
The first thing when you described it, I love that moment. The what the heck was probably a what the heck for all of us. It was the COVID bubble for MLS. So when MLS decided to resume play and they created the COVID bubble down in Florida, we didn't know if we were going to start playing again, what it was going to look like, and then they told us, you guys are going to essentially get on a plane and you're going to be down in this area, confined area, for an undetermined period of time. And we didn't have a lot of details, and we packed and prepared the best that we could with what we knew. But the what the heck was our dietitian, who was fantastic at the time, for isolation purposes, had to make buckets. So if you think of those like big ice cream pails, and then
Uh-huh.
printed name tags for
Oh
everybody,
God.
and then every pail, hydration pail, had a water, an isotonic beverage, whatever else the person wanted. So we were walking out to the field and lining the field with these hydration pails, and they were spaced out 10 feet, and everybody had individual names on them. And that was a what moment? Like, we're in a like, what is a pandemic? It's just so so many things were going on in that moment. But it's one of the memories that'll stick with me forever.
Oh, that's very good. You just brought back a memory for myself, and we made goodie bags. We called them goodie bags for all of our clients and members, and
Yeah,
they were reusable plastic. Like, of course, we're in Santa Cruz, so biodegradable plastic
yeah,
Ziploc bags with a glider, a mini band, two tennis balls taped together. We call it a peanut for myofascial work, and some kind of like TheraBand, and I think there was something else in there and a little foot wedge as well. So
yeah,
we put those outside the gym. When
yep.
they got there, would have to unlock the gym, then put them there. They'd have to walk over and grab it and then walk away. It's just like, oh, the insanity of it all. But yeah, but the things we do, the things that you do that you don't see coming, yeah, that's good. Tell me this. Answer me this, Batwoman. Your favorite injury. Like, not that you want anybody to get
Oh,
injured, but the thing that gets you just going, oh, this is cool. Like, I've got lower compartment syndrome, or I've got an inversion sprain, or I've got like herniated L1. Like, what is it?
okay. It's funny because everybody who knows me knows this answer. I love a complex hip injury. So I love if somebody, they go in, they have a nice labral repair with chondroplasty, and then you add a little bit of core muscle repair on top of that. Like, that's the best because it's so complex, but with really good strength and movement, it's completely fixable. People have really good outcomes and it doesn't take that long. We're talking like 4 to 6 months. ACL injuries also very fun, but those are a year to two before people really start getting back to that peak performance. So complex hip injuries with a little bit of core muscle on top of it, sign me up any day of the week.
Okay, so let's dive in there. We're totally going to geek out on
Yeah.
complex hip injuries. Here's my, I guess this is rant volume two. Um, I just came back from like a great return to performance conference, and there were some of the leading experts, primarily in rugby and like British Premier League soccer and all of that. We're talking about lower extremities for the most part, and adductor strains, groin strains, and so on. What I
Yeah.
found myself having an issue with is the fact that everyone is so focused on the soft tissue and the site of the trauma and not looking at the fundamental movements of the bony structure and the articulations. And so hopefully you can follow me on this, is that rather than looking at just the soft tissue itself and picking out one particular muscle like the obturator or gracilis or adductor magnus or whatever, you take there's 57 of them, so just choose one of the 57, and everyone just gets on it with a telescope and a microscope and just goes, oh, we got to do this type of movement to strengthen that one thing. And I want to pull back and go, well, what if we just looked at how the pelvis, the quality of movement, of tilting anteriorly and posteriorly, and how well can it translate over to one foot versus the other foot? So in terms of frontal plane, and what about lateral tilt to the pelvis? And for that matter, what's the quality of rotation to the left and to the right? Like, can you stay on the vertical axis? Like, when we look at the bony structure, it's so much easier to understand what they're missing. And when we incorporate those type of movements, then the soft tissue is going to have to respond if we put the players or the clients or whomever we're talking about in these specific positions and ask them to move in and out of them, so that nervous system starts to come online, soft tissue begins to lengthen and shorten, and tension begins to build and release, compression, decompression, and blah blah blah. Okay, I'm out of breath. What do you
Yeah.
talk to me about that?
Yeah, love it. No, I think there's been this big pendulum swing over my career that I've noticed is at the beginning it was very like targeted tissue approach. Hey, we're gonna get in and this is it, and I know exactly where it's injured and it's 2 centimeters distal from the proximal attachment of the blah 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 blah, and I'm gonna attack that tissue right there, and I'm gonna do all this local treatment to it. I think there was this huge swing where everyone was just like, movement, if they can do it, they're good to go. Let's not even worry about how they do it.
Ah,
And so now I think we're getting to a good what I think is a more reasonable semi middle ground. Like you need to have consideration for the injured tissue. You need to know what's happening. You need to know what phase of healing that it's in. That way that can help you prescribe your intervention, whatever it is. If somebody just acutely got injured, I'm not going to go crazy with aggressive soft tissue. That's going to add potentially more inflammation to the area, create more secondary cell death. I'm making the injury worse. Okay, no problem. So I like Dr. Enda King's work. So he is somebody who was down at
Yeah,
Sportsman
he
as
was
well.
there. And it was talking. Actually, he was my favorite presenter,
Yeah,
and
he
he was
is.
talking about a whole bunch of stuff we're talking about right
Yeah,
now.
yeah, he is unbelievable, and his work with intersegmental control, looking at, hey, if you have two groups of people, one where you do intervention only directed at the adductor group, one where it's more movement based with different groups, where you're not saying, hey, we're only going to intervene directly at the adductor. No problem. You can still not do a single groin exercise and have a positive outcome. So I think we get so far away. I would agree. It's we get so far away from, or I guess we don't get so far away. We get so zoomed in to what that injury is that if we just zoom out, especially during that initial stage where function's typically compromised anyway, like let's just zoom out and figure out what's going on, and really emphasize that. And then also just thinking about muscle mass, I think about this a lot too. Like when we have, especially recurrent calf injuries, like consider how big the calf complex is. Okay, now consider how much muscle mass there is in your glutes and hands. Like go up, go up. Maybe it's a calf issue, but maybe it's not. Like look at the volume of muscle and how does each of that function. So
Totally.
that's how I think
No,
about
and you brought up something earlier in the conversation. You just mentioned inversion sprain. I think that one of the things that is missing also when we look at the rehab to return to performance spectrum is really getting a deeper sense of previous injuries that could very well create compensatory movement patterns or altered patterns that will therefore create strain in other seemingly non-related areas, even though it's all integrated. So that issue within the complex hip injury could very well have been triggered by 6 years ago massive inversion sprain that wasn't fully rehabilitated because no everyone, it's so common that it's just like tape them up, let them go, as long as it's not swelling and there's no discoloration, they can load it, get them back on the pitch, let's go. But what
it.
they don't realize is the patterns that develop after that uh, aren't just remarkably reset. There's no magic button that you can push so that they're at the pre-injury status. So I think that's a huge thing that is just starting to percolate up to the surface that
Mhm.
we need to look at also. Would you agree with that? And can you expand on it?
No, I think that's a great point, and that's something that's a huge challenge in elite sport where it's very time-based, and I always say elite sport is like a time warp because every day feels like an extended period of time, and so, yeah, there's exactly like you said with the ankle sprain, it's like sprained it, okay, is it not swelling more? Are they, generally functional? And then you have all these criteria that you would love for them to pass. But anybody who's ever worked in pro sports knows, unless with the exception of like a long-term rehab, they're not going to hit all of them. They're just not going to because you can play through, but if you allow those compensations, then what are the trickle downs? What is the, this season, next season, 5, 10 years from now, especially as the players are getting younger and younger, and how can we help really create that environment where it is okay to take a few more days where players and everybody involved are comfortable with that because of what the potential is down the road. It's hard and I would love to hear from other listeners of your podcast, really how do you understand that and how do you explain that? Because that's another component is that informed risk that especially professional athletes that they are in this really weird part of life, I think, where their body is their job and they have this pressure to perform at their job, but don't necessarily understand all of the potential ramifications that they'll hold with them for the rest of their life, and the rest of their life for most of them means 30 and beyond.
Yeah,
And so,
right.
right, it's not like, oh, I have 15 more years, I'm just going to hobble through this. We're talking about the rest of your life and how that knee feels, how your back feels, how your body feels every day, picking your kids up, going to your work or whatever you're doing. So just, helping people figure that out, I think is really
Well,
important.
well, and then you add on to that the how would I say it? The young minds, like you say, they're getting younger and younger, and therefore there's this invulnerability. that comes along with that age. Like I can get through it all, and we don't have, for me at that time in my life, early 20s, mid 20s, or whatever, I couldn't even see past 30 years old. Like I could not envision the future me at the never mind the age I am now. I just couldn't see that. That was freaking ancient. I can't even imagine that. So the buy-in for considering long-term health, longevity, and so on, it's almost like I don't even want to go there because they're not even going to be hearing that. So, like in this scenario, how do you talk to the players when you're going, okay, we really need to spend a little bit of extra time. It's great. We'll get you on the pitch and we'll do some, we'll get you return to play. But in terms of performance, I want to hold back just another week so we can really solidify this.
Yeah, that's the $1,000,000 question. I mean, you have those conversations, right? But they don't always, ultimately their body, their choice, right?
Yeah.
And that's what it is sometimes for the reasons that you mentioned. The pressures of performing their job, the lack of ability to see further down the road. The I think a lot of it's been normalized too, where they're like, I'm a soccer player. Of course, I've sprained my ankle 9 times. Of course, I can roll my ankle right now and have my bone touch the ground. Like, there's been a lot of normalization of things. So, really, just continuing to educate, I think, is the best that we can do. And then continue to support and continue to have some objective measures. That's especially, I think, where athletes grab on is that, they're score based people. They're, feeling based people, but score based people also. So if they're like, oh, my ankle's sore, then you're like, great, here's a needle wall. Great, you're 7 centimeters on this side and 12 on your other side, and let's get that score up. Then you can kind of talk the same language, but it's tough, and I don't have a great answer to that because there's these inherent conflicts in what they're being asked to do and what our body's capable of doing and the potential long-term outcomes. So it's a tough equation.
No, I'm sure. And it's individual based. So you're not going to have one cookie cutter way of doing this, of course. But you mentioned objective measurements. And so, and you also mentioned ENDA. And so while I was down in LA for the Return to Performance conference that was happening down there with Sportsmith, I ran into somebody that we have in common here with KinetikIQ, Emma Meehan. She's the
Yeah.
founder, CEO of this markerless motion capture. And I learned not too long ago that you're on the advisory board with that. So I would love to talk about that because I think that markerless motion capture, especially what she's got going on, where it's easily accessible on your phone, like it's just the time is now. If it's been something that I've been waiting for decades to actually utilize, but I feel like the technology has caught up enough where it's actually happening. So how did you get to be involved with that, and just your thoughts around markerless motion capture? How can it benefit professional sports?
Yeah, no, I mean, Kinetic IQ is an incredible product, incredible potential too. So I joined with them last year just through beta testing before they had anything else going on. And just, they said, we have this idea, we have this product that's in its very early stages. Can you try it out and see what you think? And we did that. And I think the biggest thing I've noticed with them is just like they're very nimble because they're a smaller company and they take clinician feedback very well, and they integrate it rapidly to meet the needs of the user of the product, which hasn't always been my experience with some other platforms or some other companies. So I think, like you mentioned, I mean, like this is the answer, right? Like the answer
Yeah.
isn't a 3D motion capture lab anymore, and they're so cool. And of course, there are limitations to applications in the real world setting, but I think with some consistency, those limitations become a little bit less significant. But the portability that it offers, the ability to show people the movement. So I think we've got a lot of other objective measures that are really helpful, but there's still a pretty big blank space in the movement piece of it. And that's going to ultimately, for me, what it's about is like, how is this person moving through space and interacting with their environment? What they do on a force plate is part of the equation, but especially post-op ACL, there's a lot of really good research that shows, what they do in the gym and what they do on a force plate is so different than what they do on the field. So how can we start to capture in a valid and reliable way how people are actually moving when they're doing what we're close enough to their sport, and ideally when we get them in their sporting environment. So that's where the markerless part, I think, is also huge.
So, without giving away trade secrets, and if we're getting into that realm, please just say, yeah, well, let's move on. But are there some standard movements that using Kinetic IQ or that you look for? Like, what is it there you're using it for, whether it's on the pitch in the weight room or elsewhere?
Yeah, I think when we consider what do we use to evaluate athletes, we obviously try to consider what our goal is. So, are we looking at it from a movement screening standpoint for injury risk mitigation? Are we looking at it from a recovery standpoint? So, they did this big game. We have their pre-exertion activity numbers, and then post, and then are they getting back to those baselines? So, I think for anybody who would use it, that would be the first thing I would encourage you to do is say, you're like, what is my goal for using this piece of technology, and any piece of technology, to be fair? Like,
Sure.
like there are so many cool ones, and a lot of them, like the sales is awesome and they're flashy and you're like, this is amazing, I want it. And then you get it and you're like, wait, I actually don't know how I'm going to integrate this. So that would be the first piece, is the why. And then the second piece, we looked at what are the biggest time loss injuries across the different professional male and professional female soccer, and that's coming from the UEFA Elite Club studies. That's free access research that you can pull up on PubMed. But really looking at dorsiflexion range of motion that need a wall, and then a Thomas test or a modified Thomas test, and then potentially looking at some internal external rotation. Not totally sold on that one yet, but the dorsiflexion and the modified Thomas, from what the app and what the product is able to do now reliably, is a good starting point for what I've used it for.
Okay, yeah, dorsiflexion, got it. Thomas test, open chain, but still, if they can't achieve that range of motion with their leg off the ground, how are they going to do it with their foot on the floor? But what
Yeah.
about internal, external rotation? Like, is that a closed chain where they're standing and just having them turn to the left and to the right, or is this where they've got their leg off the ground or they're seated? How do you do that?
Yeah, that's a good point. So right now it's still open chain. So you can either do it, the seated one is the more reliable one where it catches it more often. But I would actually love to see that for, thinking about that complex hip injury. I would love to see it in the loaded position, because that's where you use it. The other thing I think of is like that arc of movement, like we have in baseball with the shoulder. I think about that a lot more with soccer players, because they often had limited internal rotation due to some of that additional bony growth. So it's like, all right, maybe they have, you know, 45, 50 degrees of external rotation, but they've got 5 degrees of internal rotation. Is that the norm for them? What's causing that limitation into internal rotation? Is it a hardened feel where the bones are approximating and you're not actually going to make a change? Is it something that we can intervene with? Like, there's just a lot of questions that come from a movement assessment. And I mean, you can speak more to that than I can, really. It's like, you get this assessment, you see a change in their movement, then it's like, all right, what's the cause? And that's like the really fun part, is
That
what
is
is,
the fun part.
yeah.
It's like better than a crossword puzzle. That's really, I love that stuff. Yeah, and there's so many other questions that come up talking to you, and so all this means is we're gonna have to do volume two somewhere down the road, because I don't want to take more of your time. You've already given me quite a bit as it is right now. Uh, I Yeah, I'd love to connect, or I'm just gonna have the open invitation. Come to Santa Cruz. We'll paddle out. We'll have a board meeting, so to speak. We'll sit out on the water, watch the otters. If you surf, great. If you don't, I'll just push you randomly into some curls, and we'll have a good time there. But this has been great, Stacey. I just honestly, I'm so stoked for you. I'm stoked for the Bay Area. Just women's soccer. And not to. I'm going to be sexist. I'm sure somebody's going to give me a comment on this, but there's certain sports that I love, regardless of gender. I love watching women's sports, especially World Cup. Oh my God, that's amazing. Um, and basketball. Like those are the two ultimate genderless sports that I just see so much growth within the women's leagues right now, which I'm super excited about because just the packed stadiums that are happening right now, it's about time, and I love it. And I don't care if there's an MLS or an NWSL match on TV, or if it could be British Premier League. I'm going to flip a coin and figure out which one I'm going to watch because they're all so good as far as I'm concerned. And so totally excited for you and what's going on at Bay FC. I can't thank you enough. If people wanted to follow you like professionally, LinkedIn, I've got the link for that. But what about like Instagram or any other social media? What do you do?
Yeah, I'm kind of a dinosaur. It's potentially something that I'm kicking around. So I have an Instagram. I haven't posted on it in almost 2 years. So I don't do that. I don't have a TikTok, any of those things. So really LinkedIn is the way to go. So connect
Okay.
on there, shoot me a message, and then that's usually where I start chatting with people from. I think there's a lot of incredible people on the web, a lot of incredible resources, a lot of incredible content. I just don't really know how to do that yet. And so maybe one day I'll figure it out, but I also just like being on the field in the gym and being with people more than I like on technology, to be honest. So
I
find
hear
me
you.
on LinkedIn and find me on the field is the best way.
Perfect. Well, again, thank you so much for coming on. And if you're keen to the idea, I'd love to find another time in the not too distant future where we can continue this conversation because I feel like we just scratched the surface.
Totally agree. Board meeting it is.
And there you go. You know, I think one of the best things about being a podcast host is I get to make friends like Stacey and call them colleagues. And I know somewhere down the road we're going to meet in person and have a fantastic time. So I want to thank her and Bay FC for making this happen. Remember, you can go to my website, rockysnyder.com, for podcast archives, for blogs, for online content, CEUs. There's some free coursework, and you get a little bit more information about me. Don't forget, if you're in the Northeast this week, check into the Perform Better Functional Summit in Providence, Rhode Island, 14th to the 16th. And if you can't make it there, you got to come and meet me in Rhode Island, September 27th, for recalibrating movement from the ground up, especially if you want to help your clients, patients, and athletes get to the next level, get around those detours of pain and ill performance, and make a difference. We'll see you next week.